intaglio. Now, Dr. Tao put these implants, pretty deep, and we used 1 point. Where's Scott? Scott, we used 1.5s. Hey, McNally. Hey, he used 1.5s on which? Do you remember? That's okay.
It was like 8.
8. That's okay. So see, you can see 8 is protruding down, 9 is protruding down. So those are 1.5s. These are 2.5s. So this is totally fine. It might be a little bit of work to get this down into the tissue in the mouth. But one nice thing is you'll never have an MUA exposed while the patient's going through healing and long-term prosthetics and all that because the head is deep. So that's okay. It just might be a little bit more maintenance when you have to seat it. Okay, this is a little trick that we learned, that I learned trial and error, is that it's tough to get a tip down inside of these wells, right? You want to get material down in here. You want to get material down in here, down underneath here, right? But you don't want to just stick a fat tip right here and push it down. So what we do is we just take a burr and we open these up and almost like, it's not occlusal, but you're making like an occlusal area, a void, so that you can put material in it. So let me get a BB burr. So I'll get some better tips next time. Hey, thanks for the tip. So I'm not doing much, detriment to this prosthetic. Just gonna open a little bit so we can drop some material in there.
5 and 13.
Oh, 5 and 13. Oh, really?
5 and 13.
Oh, sorry. Okay, so now we just backfill it. And here's something else I've learned by traveling around doing these, is that you almost want to be a little artistic with your syringe, with your tip, and don't overdo it, because the more you add, the more you have to remove, right? And this should be really clean, fast, and so I just try to like paint. Well, here I'll just do it. At this point, you can fill the carrier guide hole. You can fill this. We don't need this anymore. We're going to actually remove it from the model. But just make a little bubble right there. Wipe it away, or just fill it right to the rim. And then on these, this is important for really any full arch at surgery, is you don't want to load up a bunch of material around the necks of these. And I know different technicians do different things, but the more you load up around these necks, around these temp cylinders, the more you have to displace tissue when you go in there and deliver it. And that's a pain, because all that tissue is swollen. It's half covering the MUAs right now. So just go right to the neck of it and don't try to go up to the rim of it. You agree, James?
Absolutely. Yeah, if there's any bit of acrylic on top of that cylinder right there, the whole ridge doesn't go in. So
Oh,
when you
yeah,
get that
yeah.
for your text, just make sure you see that ring around that top of that cylinder.
That's one of the things about doing all-on-4 dentures. Is Joe still in here? No. I mean, some of those surgeries are 6 hours for one arch. He did a double arch yesterday, and he's got to do a lot of acrylic work, converting full dentures into hybrids. And I mean, this ought to be just be artistic with your. Who's the guy that used to paint on TV with the big hair?
Oh, yeah.
What's it, Bob Ross? Yeah, just put a little bit over here. This looks like a sunset, the pink, it's like a sunset. Do you have any green, Chris? We make a little tree? Yeah, that's nice. That's nice. You bring Bob Ross on. We'll bring Bob on Wednesday. Okay. That's it.